Picture this. You're a few miles into a run and everything's going really well and you're settling into a nice, smooth rhythm. And then out of nowhere, you start to feel that familiar, heavy, blocked up, restricted sensation in your nose. And naturally, you slow down a little bit. You start to mouth breathe. And suddenly, what felt like a steady, comfortable and controlled effort turns into a real struggle. If that sounds familiar, you're definitely not alone. This is one of the single most common problems I hear from runners, cyclists and triathletes. And the frustrating part is that many of you have been dealing with this for years, either just accepting it or working your way through every single nasal spray on the shelf, trying various different brands of nasal strips and nasal dilators without ever really understanding what's going on or why it keeps happening. In this video, I'm going to explain what's actually happening when you develop nasal blockage during exercise or competition. I'll help you understand how to manage it effectively and whether it's something that you can reasonably tackle yourself or if it's a sign of an underlying issue that needs a proper professional assessment. If you're new here, I'm Dr Guled Jama, a consultant ear, nose and throat surgeon based in London, and I specialize in nasal airway surgery and optimizing breathing for sports performance. And in this series, my mission is to break down common nasal and sinus related problems that affect athletes and to give you a clear overview of the treatment options that are available to help you breathe better and perform at your best. Let's get into it. Okay, so the first thing to understand and to appreciate is that your nose is not simply an opening into your face and skull. It's actually a very important and sophisticated piece of engineering. And its job is to filter, to warm and humidify every single breath of air that you breathe in from your environment before it reaches your lungs. And that conditioning effect is a crucial physiological function. Now, at rest, you might move around 5 to 8 liters of air per minute. However, when you're undertaking strenuous activity, that volume can jump drastically to 50, 60, or even close to 100 liters of air per minute. That's a huge increase in workload for a relatively narrow anatomical space. And so in response to this, when you exercise, your so-called sympathetic nervous system kicks in. This essentially means that adrenaline floods your system and is released into your circulation. One of the key effects of adrenaline is what's called vasoconstriction. In other words, the blood vessels within the nasal lining narrow down and contract. The effect of that vasoconstriction is that the so-called nasal turbinates shrink somewhat in size and allow more air to be accommodated in response to this demand in air consumption. So in theory, that is what should be happening as a normal physiological response. So why is it that in some people it feels like the opposite happens? The answer is that in those affected people and athletes, the cause of nasal obstruction during exercise comes down to one of 3 mechanisms. Although, of course, sometimes several of these mechanisms can coexist. The 3 mechanisms are inflammation of the nasal lining, a structural physical narrowing of the nasal cavity, or a dynamic collapse of the nasal airway during forced breathing. Each of these has a different pattern of dysfunction and therefore a different solution or treatment. And we'll talk about each one of them in turn. Okay, so the first and the most common reason is what's called rhinitis, which is simply a medical term to describe inflammation of the nasal lining. And there are, broadly speaking, 2 distinct types of rhinitis. The first one is allergic rhinitis, and this is commonly referred to as hay fever when it's seasonal. This is when your immune system effectively mounts a response to airborne allergens, commonly pollen, but may equally be to allergens such as dust mites or pets or molds and so on. When this occurs, the immune cells within the nasal lining, when they come in contact with allergens, release a chemical called histamine alongside other inflammatory mediators. Now, histamine is responsible for the typical irritating nasal and eye symptoms. The nasal lining typically swells, mucus production increases, and the nasal airway narrows down as a result. And so if you exercise and you're out on a run, for example, especially in spring or summer when the pollen load is particularly high, you're essentially inhaling a much bigger load of allergens each minute. And so the reaction can feel dramatically worse. And studies in athletes show that some form of rhinitis affects roughly anywhere from 1/5 up to 3/4 of competitors, depending on the sport and environment. And this figure is significantly higher than in the general population. And so endurance athletes and those who train in environments with poor air quality are particularly affected. The other form of rhinitis is non-allergic rhinitis. You may sometimes hear it being referred to as vasomotor rhinitis. The problem with this condition is that the nasal lining and its blood vessels are essentially overreactive. They can be triggered by environmental stimulants such as cold air or dry air, temperature changes, pollution, strong smells and fragrances, and in some people, simply the act of sustained heavy breathing. There is also an interesting subtype that is referred to as exercise-induced rhinitis, where large volumes of unconditioned air irritate the nasal lining, producing a reflex surge of mucus and congestion when you train. And so during outdoor training, particularly in cold mornings, winter races or city routes with traffic, you can imagine you're hitting several of these potential triggers at once, which can be hugely problematic for some people. The second important category of nasal obstruction is a structural nasal deformity. In other words, an anatomical abnormality which is leading to a fixed physical narrowing of the nasal passage. The two common culprits here include a deviated nasal septum and turbinate enlargement. The nasal septum is the thin structure made of cartilage and bone which forms the partition that divides the nasal cavity into two halves. Now it's worth knowing that a slight bend or deviation of the septum is actually very common, and for most people it doesn't cause any problems at all. In fact, a perfectly straight nasal septum is relatively rare. The issue arises when the septum is significantly deviated. If it leans too far to one side, it can narrow the nasal passage and make it much harder for air to flow through. That's when people start to notice symptoms. A common way patients describe this is having one good side and one bad side, so they can breathe comfortably through one nostril, but the other feels blocked, even at rest. Some people also find themselves mouth breathing at night, or their partner may notice that they're snoring. And these are all typical signs of nasal obstruction caused by a deviated nasal septum. Another subgroup within this category of structural abnormalities is related to the nasal turbinates. These are cushions of tissue which sit on the sidewalls of the nasal cavity, and they play an important physiological role in filtering particles from the inhaled air and also warming and humidifying the air that you breathe in, as we briefly touched on earlier. Sometimes these soft tissues can stay swollen for extended periods of time. This can happen because of inflammation in the nose and sinuses, allergies, or simply the way someone's anatomy has developed. When the turbinates are persistently enlarged, they take up more space inside the nose and reduce the room available for airflow. For some people, this narrowing is relatively mild, and they only really notice it when they have a cold or during hay fever season. But in others, that space can become very tight, and so certain activities, including exercise or intense physical activity, push them over the edge, and they become very aware of inefficient airflow through the nose. Looking at the two types of nasal obstruction we discussed so far, you can think of these as behaving quite differently over time. With mainly inflammatory conditions, such as allergic rhinitis, symptoms tend to come and go. They fluctuate. You might have some good days and some not so good days, and symptoms often significantly improve with antihistamines or nasal sprays. Furthermore, for many people, symptoms are worse at certain times of year, such as during pollen season, although in others, they can be a problem all year round. Structural nasal problems, on the other hand, are typically different. Here, the nasal blockage is usually fairly constant and often one-sided, especially in the case of a deviated septum. Because this is a fixed physical issue rather than an overreactive immune response in the nasal lining, it usually responds only partially or sometimes not at all to medications, such as intranasal steroids. Now let's talk about the third mechanism of nasal obstruction that I commonly see in athletes. This condition is what is often referred to as nasal valve collapse. The nasal valve refers to the narrowest component of the nasal airway, right near the nostril. And so when you exercise really hard and your breathing rate and the force of inspiration increases, you create a negative pressure inside the nose with each breath in. And in people whose nasal cartilages are relatively weak or not well supported, that suction effect can cause the sidewalls of the nose to buckle inwards and narrow the airflow. Because this tends to happen mainly with forceful inhalation and not usually when you are resting, it is often called dynamic nasal valve collapse. You may have seen or used external nasal strips or internal nasal dilators, and the reality is that these can help. They provide a temporary improvement by physically opening and splinting the nasal valve area. However, as you can imagine, they're clearly not always an effective or long-term solution in everyone, especially in more severe or persistent cases. So if you experience nasal obstruction or blockage during intense exercise, it's usually down to one or more of three things: an inflamed nasal lining, also referred to as rhinitis, a fixed structural narrowing such as a deviated septum, or a dynamic collapse of the nasal airway, such as in the case of nasal valve dysfunction. The good news is that all three types of causes have effective treatment options, and identifying and dealing with the underlying problem can make exercise, high intensity performance and recovery feel like a completely different experience. So make sure you check out my upcoming videos as part of this series, where I will discuss treatment options for each of the conditions we discussed today in more detail. If you found this information helpful, I would really appreciate it if you could consider subscribing to this new channel. I'd also love to hear from you, so let me know in the comment section what topics or questions you'd like me to cover in future episodes. Your feedback genuinely helps me plan content that is most useful for you. It also helps other athletes discover clear, evidence-based information so they can make better decisions about their health and find reliable answers to help them breathe better and perform at their best. See you in the next one.